Hello everyone, my name is Jemima, and today I will be presenting a case of infantile hemangioma in the chest and neck. What is infantile hemangioma? It's a benign tumor which develops from blood vessels. They form a red lump on the skin which grows within the first months of life. They are more frequent in infant girls of Caucasian descent who were born prematurely. Though their aspect may alarm some parents, those tumors are most of the time absolutely benign, as I said, painless, and disappear within a few weeks to a few months without requiring any surgery or treatment. That being said, there are some locations which are at risk of complications. For instance, the mouth, the bottom, neck, eyes, and nipples, because they can easily become sore or even infected. Our patient had her tumor inside her neck, which caused severe breathing problems. The patient is a 4-month-old girl who was admitted to the ear, nose, and throat department because she had trouble breathing. And she also had difficulties feeding since she was 1 month old. And as part of her medical history, she had bronchitis, which was treated at the hospital since she had breathing difficulties with antibiotics and steroids. The medical exam did not show any signs of lung damage, asthma, or infection, and there were no signs of low oxygen levels either, which could be suggested by blue lips or cold hands and feet. Then the doctors performed an endoscopy, which is an exam where a tube with a small camera is passed down the patient's throat to look for any abnormalities in the breathing pathways or the gut. In this exam, they found that the trachea was narrowed at the top. To find out why, the patient was sent to an MRI scan, which found a large 10 centimeter tumor, which tightened the trachea and extended to the neck vessels and muscles on the right. And its image, its aspect, pointed towards a hemangioma. But in this case, it is very important to note that there were no skin lesions, so it made it much more difficult to diagnose hemangioma. And her main symptom being a shortness of breath that could easily be mistaken for something else, like an inhaled object or an infection. As for the treatment, no surgery is required to remove the tumor. Instead, the patient was given a beta-blocking drug to reduce its size. But before starting the treatment, the patient has to undergo a quick heart evaluation to make sure that there are no major heart issues which could prevent them from taking the treatment, because beta-blocking drugs are known to slow the heart rate. So our patient had her heartbeat measured and an echography to make sure her heart is shaped correctly, which was the case. So the patient was seen 3 months later at a control scan, which showed that the tumor had shrunk and the treatment was effective. So to recap, hemangiomas are benign and frequent tumors in infants. They require no treatment unless they are at risk of complications, which was the case for our patient. And in that case, a beta-blocking drug is enough to remove the tumor. That's all from our presentation. Thank you for listening, and see you soon.